Welcome to Literature Searching and Resources for Evidence-Based Practice. This presentation is by the University of Washington's Health Sciences Library. Why should you do a literature search? A literature search, whether in-depth or brief, helps to explain the background of research on a topic. It demonstrates why a topic is significant to a subject area. It discovers relationships between ideas. It suggests unexplored ideas or populations. It tests assumptions and may help counter preconceived ideas and remove unconscious bias. It identifies critical gaps, points of disagreement, or potentially flawed methodology. And it can indicate potential directions for future research. A literature search and literature review take time and planning. Be sure to define your research question. Plan your approach to your research and your review. Make sure you give yourself enough time to search the literature. You'll need to analyze the material you found and manage the results of your search, and also write your review if you're doing a literature review. What type of review do I need to do? A literature review, scoping review, or systematic review? Ask the individual who assigned you the project for further clarification. A literature review synthesizes scholarly literature on a topic by evaluating a selection of sources. A scoping review synthesizes evidence and assesses the scope of literature on a topic. A systematic review collates all empirical evidence to answer a specific research question. If you need more information about how to do a literature review, the UW-Tacoma has a great library guide that you can use regardless of which campus you attend. You can access this library guide at the address listed on this slide. If you need information about scoping reviews, PRISMA offers a checklist of items that are important to include. PRISMA is an evidence-based minimum set of items for reporting in systematic reviews and meta-analyses. You can find PRISMA's resources at the websites listed on this slide. PRISMA focuses on systematic reviews and has a variety of resources that you can use. The UW also has a library guide about systematic reviews, and you can find the websites listed on this slide. This presentation focuses on evidence-based practice, but what is evidence-based practice? EBP is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. Why does it matter? EBP directly impacts both the quality of care that patients receive and their medical outcomes. How does it work? EBP integrates information literacy with your own clinical expertise and patients' values and preferences. Is evidence-based practice identical to evidence-based medicine? How are they different? Historically, evidence-based medicine primarily involved physicians and concentrated on the treatment aspect of medicine. Evidence-based practice takes a more multidisciplinary approach and includes many facets of health. Evidence-based practice can be visualized as this overlap between your clinical expertise, the best external evidence, and patient values and expectations. This is an overview of Pico, which is essential for evidence-based practice. The Pico Framework helps you to organize and structure the multiple elements of your question to inform your search strategy. The elements of a Pico question are problem, intervention, comparison, outcome, and it includes the optional element of time. It is who or what you're studying, the intervention you're considering, what you're comparing the intervention to, what you're trying to accomplish, and any related time frame. The Pico example that we will be using in this presentation is Does management of type 2 diabetes reduce heart attack risk in women over age 45? Our population is women over age 45 with type 2 diabetes. Our intervention is diabetes management. Our comparison is uncontrolled or poorly controlled diabetes. Our outcome is a reduction of heart attack risk. Some of the best practices for Picosearching are to brainstorm terms to use in your search. Include alternative terms and keywords. The best words to use for your search may be different from the ones than you expected. Start by searching broadly. You can narrow your focus later on in your search. You want to start by casting a wide net and then narrow down the results later. Use Boolean operators and filters and limits. These help to make your search more accurate. We'll go over Boolean operators later on in this presentation. And be sure to use multiple databases and sources. Don't limit yourself to just one database. Information literacy is essential for evidence-based practice. But what is information literacy? Information literacy allows us to recognize when information is needed, and it's the ability to locate and evaluate and use that information. Information literacy helps us avoid being deceived or misled. It's also a survival skill in the information age. It helps us to solve problems and make decisions. And it also helps us to navigate a tidal wave of information. Now that we've touched on evidence-based practice, Pico questions, and information literacy, we're ready to combine these tools and begin our literature search. There are many resources for research: internet search engines, database searches, publicly available resources, and institution-restricted resources. Different types of research are considered more authoritative than others for evidence-based practice. This is the hierarchy of research design, or evidence-based pyramid. There is a hierarchy to research design, and it indicates the authority of the research for evidence-based practice. This hierarchy can be visualized as a pyramid. Higher quality evidence is at the top, and lower quality evidence is at the bottom. This placement also reflects the amount of research material available at these levels. At the bottom of the pyramid, you will find numerous opinions and anecdotes, while at the top you will find a smaller number of systematic reviews and meta-analyses. There are many ways to visualize the research pyramid and hierarchy of research design. This is another example of an evidence-based practice pyramid. Regardless of the visualization, you will find that the quality of evidence increases as you go up the pyramid, where you will find the gold standards of systematic reviews and meta-analyses. The hierarchy of research design and pyramid of evidence follow established guidelines for determining the quality of evidence. The guidelines followed by Johns Hopkins has established 5 levels for evidence-based practice in nursing. Level 1, which includes systematic reviews of randomized controlled trials, is considered the highest level, while Level 5, which includes expert opinions, is considered the lowest level. We have discussed searching the literature for research, but we also need to define what exactly research is. Research is the organized quest for new knowledge and better understanding. Research is investigation or experimentation aimed at discovery and interpretation of facts, revision of accepted theories or laws in light of new facts, or practical application of such new or revised theories or laws. Identifying research articles. How can I tell if an article is research? One easy way is to begin by examining the title of the article. In these examples, the authors have clearly indicated that this is a systematic review and a qualitative analysis. This communicates to us that these articles are research. You can also examine the abstract or full text for key phrases. These key phrases may include, "This study examines," "This study's findings support," or "We investigated." can also use the Mrap method to identify research articles. Mrap is a method where you examine the article for structure. The key elements of a research article are introduction, methodology, results, analysis, and discussion. The example here was easily identified as research using the Mrap method. Identifying research versus expert opinion. The research pyramid and pyramid of evidence rank research as higher quality evidence than expert opinion. But isn't research conducted by experts? How is expert opinion different from research? Remember that research is the organized quest for new knowledge and better understanding, whereas expert opinion is the personal opinion of an expert. The expert may or may not be qualified to comment on that specific topic. An expert opinion is also a summary of existing knowledge or information about a topic. It's not contributing to new knowledge. Expert opinions can look like many things and can also have different levels of authority. An expert opinion can be a consumer health information blog written by a medical doctor. It can be a textbook written by subject matter experts, or it can be a commercial website selling products endorsed by an expert. It can be easy to confuse research and expert opinion. But what do all types of research have in common? Context: prior research on the topic with future directions. A structured process: it uses a scientific perspective to analyze a specific research question of interest and to develop an approach for studying it. A methodology: it follows recognized procedures appropriate to the research area. And objectivity: it incorporates multiple perspectives yet remains unbiased. Ask yourself, why is the expert sharing their opinion? Is it to make knowledge more accessible? Is it to promote the public good? Are they providing educational materials for schools? Are they promoting their new book? Are they selling a product? We're going to go over a few examples of research and expert opinion to practice identifying them. Here we have two electronic resources on similar topics that I located through the Health Sciences Library website. On the left is an article from the journal Primary Care Diabetes, and on the right is a chapter from a medical book. Consider for a moment if these are research or expert opinion, and why you came to that conclusion. You can pause the presentation here before moving on. The article on the left is research, and the book on the right is expert opinion. Remember that books and textbooks summarize existing knowledge, and research creates new knowledge. While both of these resources were created by subject matter experts trained in the field of medicine, we would consider the research article to have higher authority than the textbook for evidence-based practice. What about these two examples? We have an article published by UW Medicine on the left, and we have an article published by a journal on the right. I located these resources using an internet search. Consider if these are research or expert opinion. You can pause the presentation here before moving on. The article published online by UW Medicine is expert opinion, and the other article is research. The research article in this example was cited in the article published by UW Medicine. By following the citations, I was able to locate a more authoritative source for information on this topic. Again, both of these resources were created by professionals in the field of diabetes care. Search engines like Google are how many of us begin searching for information online. The four most popular search engines in 2019 were Google, Bing, Yahoo, and Baidu. Baidu is a Chinese language search engine, so there are options for searching beyond the English language focus of many other popular search engines. An important consideration for using search engines for your research question is that search results can be biased. Multiple factors influence search engine results, including other online activities, previous internet search history, and how other searchers have interacted with search results. Search engines can be great tools for finding information, but be sure to understand that the results you receive are not displayed in order of authority or factual accuracy, but by the search engine algorithm. What about using Wikipedia for my research? For best practices, don't rely on Wikipedia. Entries can be added, edited, or deleted with very little oversight. Information can also be wrong or misleading. If you're going to use Wikipedia, use it for an introduction to a topic, and then do your research using other resources. Health information websites are very popular sources of information. We're going to talk about the ABCs of evaluation. These evaluation skills are helpful both as a medical professional and as a consumer of health information. One popular evaluation tool is called the Mrap test. It was developed by librarians at California State University, Chico. It's meant to provide guidelines for critically evaluating health information online. We're going to go into greater detail with each of the elements listed here: currency, relevance, authority, accuracy, and purpose. An important question to ask yourself when evaluating a health information website is, does this source pass the Mrap test? Currency is the timeliness of the information. When was the information published or posted? Has the information been revised or updated, and if so, when? Does your topic require current information, or will older sources work as well? And are the links still functional, or are they outdated? Relevance is the importance of the information for your needs. Does the information relate to your topic or answer your question? Who is the intended audience? Is the information at an appropriate level? It's not too basic or advanced? Have you looked at a variety of sources before determining that this is the one you will use? Would you be comfortable citing this source in your research paper? Authority is the source of the information. Who is the author, publisher, source, or sponsor? What are the author's credentials or organizational affiliations? Is the author qualified to write on the topic? Is there contact information, such as a publisher or email address? And does the URL reveal anything about the author or source? Accuracy is the reliability, truthfulness, and correctness of the content. Where does the information come from? Is the information supported by evidence? Has the information been reviewed or refereed? Can you verify any of the information in another source or from personal knowledge? Does the language or tone seem unbiased and free of emotion? Are there spelling, grammar, or typographical errors? Purpose is the reason the information exists. What is the purpose of the information? Is it to inform, teach, sell, entertain, or persuade? Do the authors or sponsors make their intentions or purpose clear? Is the information fact, opinion, or propaganda? Does the point of view appear objective and impartial? Are there political, ideological, cultural, religious, institutional, or personal biases? Health on the Net is another tool you can use to evaluate health information sources online. HON is a not-for-profit organization that promotes transparency in health information. Note that many good health information resources that pass the Mrap test may not have the HON code logo on their website. The HON code principles are authoritative, complementarity, privacy policy, attribution and date, justifiability, transparency, financial disclosure, and advertising policy. The website must indicate the qualifications of the authors. The information should support and not replace the doctor-patient relationship. The website should respect the privacy and confidentiality of personal data submitted to the site by the visitor. It must cite the sources of published information, date medical and health pages for when they were last updated. The site must also back up claims related to health benefits and performance. The site must be accessible and include accurate email contact information. The site must identify funding sources, both commercial and nonprofit. and it must clearly distinguish advertising from editorial content. We're going to go over some of the resources offered by the Health Sciences Library. Many of the databases we'll discuss in this presentation are available through the UW Health Sciences Library website. The Pubmed index can be searched by the public, but full text of articles may be restricted to those with institutional access, like through the UW. Once we go over HSL resources, we'll discuss controlled vocabularies and keywords, search terms and search strategies, and we'll do some sample searches with our Pico question. There is a library guide for the Health Sciences Library and its resources. If you would like more information or want to view additional tutorials, the Introduction to HSL resources can be accessed at the URL listed on this slide. Please note that the University of Washington Libraries page is not the same as the Health Sciences Library. The HSL has its own dedicated website designed for the needs of students, researchers, and workers in the health sciences field. This is the main page of the Health Sciences Library website. We'll go over some key features and important things to know about the HSL. You can access this website at hsl.uw.edu. Highlighted on the left is the navigation menu for key resources. Highlighted on the right are important sources of information, such as how to request an article, how to connect off campus, and your library account. And on the top is the Ask Us feature, which allows you to submit questions online to HSL librarians. We're still viewing the resources available on the Start Here tab. Highlighted are some of the most popular databases to use when searching. You can also find links to HSL e-journals and ebooks. The HSL has multiple toolkits for healthcare specialties. Here we are looking at the contents of the Registered Nurse Toolkit. These are some of the most helpful resources that the HSL offers for RNs. While the HSL has toolkits for different healthcare specialties, you don't have to limit yourself to the toolkit associated with your school program or area of work. You can use any of the toolkits that you find relevant. The HSL has a wide variety of library guides. You can see here that some of these guides are how-tos that explain searching in specific databases, and that some courses have their own library guides as well. You can also see on the bottom left the guide for getting started with the HSL, which we briefly mentioned earlier. Here you can see a list of HSL databases. You can navigate these databases alphabetically. This list is accessible by clicking on the Databases tab. Here you can see some of the services that the HSL offers, including how to access your account and how to order articles and request an interlibrary loan. Interlibrary loan and article scanning services are available to UW students, faculty, and staff. These services can connect you to materials that the UW doesn't have at no cost to you. Be sure to set up your Interlibrary Loan account at the site listed on this slide before making a request. The UW has information on how to connect to library resources from off-campus. The UW Library's licensed online resources use the IP address of your workstation to identify you as a member of the UW community. If you are on campus, no additional authentication is usually required. If you are off campus, your internet connection needs to be routed through the UW Library's off-campus proxy service, which identifies authorized users via UW Net ID. This online guide can help you address common issues you can face when connecting to the library resources from off campus. These are some of the steps that we recommend to take when beginning your database search. Identify key concepts that you're interested in. Generate synonyms and alternative terms. Identify controlled vocabulary terms. Combine your search terms using and, or, and not which are Boolean operators. Pick a relevant database to start with, then try different versions of your search in that database. Refine your search results by adding, subtracting, and changing terms, and by applying filters and limits. Then repeat the search process with additional databases that are relevant to your topic. We'll go over some of these steps in greater detail. Please keep in mind that searching is an iterative process. Your search will evolve, which means that you must be flexible and try new strategies. For example, use the results from one search strategy to help you decide your next search strategy. Check the Pubmed search details to show you how your search was interpreted. Consider using mesh terms, Cinahl headings, or other controlled vocabulary terms in addition to your keywords. And try citation chasing, or cited reference searching in Scopus, Google Scholar, and Pubmed. Who else has cited this article? Controlled vocabularies provide a means for organizing information. Controlled vocabularies serve 5 purposes. Translation. They provide a means for converting the natural language of authors, indexers, and users into a vocabulary that can be used for indexing and retrieval. Consistency. They promote uniformity in term format and in the assignment of terms. Indication of relationships. They indicate semantic relationships among terms. Label and browsing. They provide consistent and clear hierarchies in a navigation system to help users locate desired content objects. And retrieval. They serve as a searching aid in locating content objects. Controlled vocabulary entries often include several of the following. A definition of the term, sometimes called a scope note. Potential subheadings that can be added to narrow the search further. Entry terms, which are keywords that map to the controlled vocabulary term. Where the term falls in the hierarchy or tree of related terms. And broader, narrower, or other related terms. Here we can see the difference between keywords and controlled vocabularies. On the left is a list of terms that we brainstormed to search for information about heart attacks. On the right is the controlled vocabulary entry used by Pubmed. Information in Pubmed about heart attacks will be indexed under myocardial infarction. By combining keywords and controlled vocabulary terms, we can improve the scope and accuracy of our search. Controlled vocabularies may also be called subject headings, subject terms, thesaurus terms, descriptors, or index terms. You can see that PsycInfo, Cinahl, and Embase all refer to their controlled vocabularies using different names. MESH is a controlled vocabulary that is widely used by health science databases, notably by Pubmed. MESH stands for Medical Subject Headings and is used to organize topics in a logical manner. You can access the MESH database from Pubmed's homepage. The address is listed on this slide. This is the MESH entry for myocardial infarction. The MESH database defines what the term is and lists a variety of subheadings that I can choose from if I want to restrict my search to one of the areas listed. Note that I entered the words heart attack into the database, and MESH automatically took me to the controlled vocabulary term of myocardial infarction. Scrolling down the page for the MESH term myocardial infarction, we can see the hierarchy of terms. There are narrower terms listed under our term, and broader terms listed above it. This format is often called a controlled vocabulary tree for the way the terms branch out and build on each other. When researching your Pico question, consider when to use keywords and when to use controlled vocabulary. Keywords are useful for a quick search, for new terminology, for acronyms, for truncation, but they can always be combined with controlled vocabulary. Controlled vocabulary allows for a deeper search. It searches established content. It's also helpful with acronyms, and it can be combined with keywords. Remember that controlled vocabulary offers more control. Both your word choice and your word order can impact search results. Here you can see how search results were impacted in Pubmed and Cinahl. If you're not getting the results that you need, or you're finding unexpected or irrelevant results, take a moment to review your word choice and your word order. This is why your search will evolve as you go. We're going to go over how to combine your controlled vocabulary terms and keywords with Boolean operators. Boolean operators are a tool that allows you to improve and refine your search results by combining your search terms using the words and, or, and not. Boolean operators give context and greater meaning to your search terms. The way that you combine terms shows the relationships between these ideas. They allow you to build more complex and accurate searches. Here is a simple way to visualize Boolean operators. The two most commonly used Boolean operators are the words and or. In this example, our two keywords are fish and sticks. Using the Boolean operator and will return results that only include both of these terms together. Using the Boolean operator or will return results that include either fish or sticks alone, and will also return results where they appear together. Boolean operators can also change the meaning of the words that we search. In this example, our keyword fish can refer to the animal. Our keyword sticks can refer to wood or branches. But by using and or, we've created a new definition that means breaded food product. We're going to take a closer look at Boolean operators and how we can use them to search our Pico question. We make our search more accurate by combining the terms heart attack and type 2 diabetes with the Boolean operator and. For our Pico question, we need information where these two conditions overlap. Using and will cut out irrelevant search results. For this portion of our Pico question, we're using and instead of or because of how these two operators impact search results. If we were to search heart attack or type 2 diabetes, then we would receive results that include everything with these two conditions, when we only need information where they overlap. You can use the Boolean operator not to remove things from your search results. In this example, we want to focus only on heart attacks and exclude strokes. We would search heart attack, not stroke, and that would refine our results by removing information that is not related to our Pico question. How do we combine our Pico search terms with Boolean operators to create an effective search? You can start by creating a list of keywords and controlled vocabulary terms that are relevant to your Pico question. As seen here, we've broken down our Pico question into separate elements and listed out some of the relevant terms. Once you've identified your search terms, you can use these tips to build your Pico search. Use parentheses to connect ideas and relationships. Use and between columns to connect your Pico terms. Use or between rows to connect related keywords. And filter based on population characteristics. Now that we've decided how to combine our search terms by using Boolean operators, we can build our search string and visualize where we will find our results. Our Pico question of, does management of type 2 diabetes reduce heart attack risk in women over age 45, can be searched in a database with type 2 diabetes, and heart attack, and risk. You can see on the Venn diagram where these Boolean operators will find our results. We want information where our keywords all overlap. You may be wondering why we're not using the search terms women or over age 45, and that's because these search parameters are best done using filters and limits in the database. We'll go over how to apply filters and limits later on. After using the search string on the previous slide, we find that we need to add the operator not to exclude irrelevant results. Here we've added not stroke, which shifts where our relevant results will overlap. You can see in the updated search string that heart attack, not stroke, are grouped together inside of parentheses. You can use parentheses when searching with Boolean operators to group ideas together. We've grouped heart attack with stroke because our search results found that these two conditions are often researched together, and we want to separate out strokes, which are not our area of focus. Now that we've gone over how to use keywords, controlled vocabulary terms, and Boolean operators, we're going to do some sample searches for our Pico question. We're going to be using Pubmed and Cinahl. Cinahl is the cumulative index of nursing and allied health literature, and it's a great resource for nursing-specific research. By searching these two resources, we will see how the number and scope of results can differ. This variation is why you should always search more than one database. Consider the Pico question that you would like to research. Do you know which databases or resources would be best to use? Where would you like to start your search? These are some of the databases that are available through the Health Sciences Library. We'll briefly touch on many of these. When identifying which databases to use, consider what traditional databases, like Pubmed and Cinahl, have to offer for your search. You can view recent research in your area and view articles that focus on research methods in a given area. Remember that you can access a full list of databases from the Health Sciences Library homepage. There are also specialized databases that can be a great resource for your Pico question. This is a brief list of some of the specialized resources that are available and their areas of focus. After considering what traditional and specialized databases have to offer for our Pico question, we're going to use the traditional databases of Pubmed and Cinahl. These databases are accessible from the Health Sciences Library homepage, and they're also linked in the provider toolkits like the Registered Nurse Toolkit listed here. Please note that Pubmed is updating its design, so you may see the new interface that's shown here or the older interface. You can follow along in Pubmed and Cinahl and try these searches yourself as we go, or just watch the video. You can see that we found significantly more articles for these search terms in Pubmed than in Cinahl. So why are we searching Cinahl? Because Cinahl focuses on nursing-related literature and research, it may have research articles that Pubmed has not indexed. Please note that if you're following along with this search, the number of results that you get may vary from this presentation. New research is constantly being published. When searching in Pubmed, you can click on Advanced under the search bar and review your search history. The text on the right is what I entered for my search, and the screenshot on the left is how Pubmed interpreted my search. You can see that Pubmed broke down my search terms and applied alternative terms and mesh terms to my search. This helps make Pubmed searches more thorough and accurate. If your search in Pubmed is returning unexpected or irrelevant results, go into the Advanced Search and open your search history to see how Pubmed interpreted your search. You may find that your keywords are interpreted by Pubmed differently than you thought. You can then edit your search to make it more accurate. Limits and filters help to narrow and fine-tune your search so that it better reflects your question. An example of some filter options are that they help you to define your patient or population, they let you choose the type of publication that you need, and they let you select the date of publication. One of the filters you can apply in Cinahl is a filter that removes results which are also indexed in Pubmed. By filtering out results that are indexed in Pubmed, you cut down on the number of duplicate articles you may find when searching. In Cinahl's Advanced Search option, scroll down and select the box to exclude Medline records. This will remove results that are listed in Pubmed. Other databases may have similar filtering options. Be sure to explore their advanced search and filtering features to familiarize yourself with these tools. Here we've started to apply filters and limits to our search. Our initial search is listed on the top, with over 3,000 results in Pubmed and 1,200 results in Cinahl. By limiting the results to randomized controlled trials published between 2010 and 2020, we've significantly narrowed our results. On the left is a screenshot from Pubmed of how we applied those filters. We're not done adding filters to our Pico question yet. Remember that we're searching for information related to women over age 45. So by applying the filters listed here, female, age 45+, and human subjects, we further narrowed our results in both Pubmed and Cinahl. By selecting controlled vocabulary terms, adding Boolean operators, and using filters and limits, we found articles that are strongly related to our Pico question. These search results are going to be much more relevant to our Pico question than if we did not use a search strategy. The search strategies that we've discussed can be applied to many of the resources and databases that you use. Each database will have a different user interface, and they may have different controlled vocabularies, but best practices for searching can be applied across them. Remember that some databases allow you to exclude results from Medline or Pubmed, which eliminates the problem of finding duplicate articles. Some databases allow you to create your own user profile, where you can save custom searches and save your search results, which you can return to later. You can see database user guides for training tutorials and how to set up individual user profiles. We're going to go over forward citing in databases. Forward citing is where you see where an article has been cited by someone else. You can use forward citing in locating more recent research on a topic. You can follow these citations to newer information and see what is currently being written on a topic. You can see which authors appear most frequently and what keywords or controlled vocabulary terms are assigned to relevant articles. You can use all of this information to improve your own search strategy. When searching in Scopus, you can see where articles have been cited when looking at an individual article. You can scroll to the end of an article in Pubmed to see a list of where that article has been cited. And Google Scholar will also show you where articles have been cited. We're going to briefly go over some of the databases that the UW offers. Scopus has powerful search features that allow you to refine your search and to also explore individual authors. UpToDate is a point-of-care tool that allows you to find clinical information on a variety of health topics. Web of Science is a citation database that includes global research and interdisciplinary subjects. Embase includes citations on biomedical literature outside of the US. Embase can be particularly helpful when researching topics that are not widely studied in the US. NIH Reporter searches a repository of NIH-funded research projects and publications. ClinicalTrials.gov is a database from the National Library of Medicine. It includes public and privately funded clinical research studies that are conducted around the world. The Cochrane Library contains information on systematic reviews, controlled trials, economic evaluations, and other resources. You can use the Cochrane Library to find clinical answers, reviews, protocols, and editorials. You can also use the Cochrane Library for information on the methodology used in studies. The Campbell Collaboration is a database of systematic reviews of the effects of social interventions in crime and justice, education, international development, and social welfare. ProQuest Dissertations and Theses Global indexes dissertations from all fields of study. Sage Research Methods contains articles, books, case studies, datasets, and videos covering quantitative, qualitative, and mixed methods research methodologies. Sage Research Methods also allows you to browse and use datasets, which are indexed by method and data type. Another feature of Sage Research Methods is the ability to review cases to better understand methodological concepts. The Agency for Healthcare Research and Quality's Innovation Exchange provides information about evidence-based innovations and tools. To find the full text of articles, look for these buttons in the databases. The Check for Full Text button will show if the article is available for immediate download through any of the UW subscription services. It also gives you the option to order the article from Interlibrary Loan if a download is not available. Remember that you must be logged in as a member of the UW community to access many of these resources and the full text of articles. See the URLs listed here for additional help. Interlibrary Loan will scan and deliver journal articles from the UW Library's print collection as well as from other libraries directly to you at no charge. This service is available for current UW students, faculty, and staff only. What resources are available to you if you're not a member of the UW community, or you can't travel to one of the UW campuses to use their guest access? Hsl is an online medical library for licensed Washington State practitioners. Hsl provides access to licensed practitioners of specific medical disciplines, the full list of which can be found on Hsl's website. Hsl is a great resource for small clinical offices and for practitioners in rural locations who don't have access to their own medical library. It's important to note that Hsl's online medical library is not the same as the UW Health Sciences Library. While both Hsl and the UW offer a variety of resources, the scope and specific areas of coverage will vary between them. You can find more information on getting access and getting started with using Hsl at the URL listed on this slide. Hsl offers a variety of toolkits for licensed practitioners. Each toolkit contains resources that are highly relevant to their area of expertise. Licensed practitioners can use any of the toolkits on Hsl's website. They're not limited to any individual toolkit. Here we can see some of the contents of the Registered Nurse Toolkit. Users can access databases, ebooks, e-journals, and continuing education resources. Hsl offers resources for continuing education requirements. For example, one of the CE resources for registered nurses gives you access to free online CE courses offered by the UW. Hsl also has resources on drugs and drug tests, including the Drug Information Portal, LactMed, and Natural Medicines. You can access a full list of databases that are available through Hsl on their website. This is just a partial list of their databases. One popular resource available through Hsl is Dynamed. Dynamed is an evidence-based clinical reference tool. It contains more than 3,400 topic summaries across all disciplines. It's updated daily on a surveillance of over 500 journals and critical appraisal of the best articles. Dynamed also includes Micromedics drug resources, and a mobile app is also available. Both Cinahl and Pubmed are available through Hsl, which provides powerful search tools for your research needs. Hsl offers tutorials and guides for users, whether you are just getting started or are an experienced searcher. These are some of the resources that you may find helpful. What if you don't have access to the UW, to Hsl, or to other institutional resources? What if your patients need health information for their own reference? The National Library of Medicine has publicly available resources that provide information using evidence-based practice. These consumer health resources adhere to best practices with the most recent evidence. This is a selection of the National Library of Medicine's free online resources that are available to patients, the public, and to you. Medline Plus is highly recommended for consumer health information. It does not endorse products or have ads, which allows users to focus on unbiased information. Public libraries also play a large role in serving health information needs. Health information seekers can face barriers, like a lack of searching experience and paywalls, when searching online, so public libraries can provide both resources and training on searching techniques. Pew Research studies found that 8 out of 10 online health inquiries start at a search engine, and that many people use public libraries to find health information. For example, the Seattle Public Library provides resources on the topics of health and medicine and on genealogy. The Public Library Association, in partnership with the National Network of the Libraries of Medicine, provides resources and training on consumer public health. The NNLM has a regional branch located within the Health Sciences Library. They provide consumer health information online that both you and patients can use. What do I do if my search results are too broad? Check your question, add limits or filters, add another term, or ask a librarian. If your results are too narrow, check your question, remove filters and limits, remove terms if you have a lot of them, and ask a librarian. How do I tell if my results are too broad or too narrow? That depends on your research question. Thousands of results can indicate that your question is too broad and should be narrowed. No results, or very few results, can indicate that your question is too narrow and should be broadened. There is a huge variety of resources available to you for help with your research question. Some resources are available to the UW community, and some are publicly available. When you're stuck, review the best practices for searching, review guides on the database that you're using, check out the toolkits and library guides that are available, and then ask a librarian for help. For UW students, the Health Sciences Library has a writing center where you can make an appointment for one-on-one writing help. Have questions? Let us know. Thank you for watching our presentation.